Hey,
We are
It looks like
live.
Dr. Wade is
Dr.
joining us.
Lowry
Hello,
back.
good morning.
Hey, can you go ahead and give Leganzi a vaccine on air while we're doing this today?
Mackenzie, I need to come to the radio
I would gladly
station.
take it, but no one would give me one. They said, "Well, you're not a teacher. You have to wait." So
That's true.
I need
That's true. Your time come.
I need some school to hire me for one day. I have a teacher's license. It just expired.
Oh no. So y'all, we are live on Facebook. We have about a minute or two to go before we go on air. So good morning to you. Sorry, you just kind of got into conversation in the middle.
Dr. Wade, welcome to KLEK. I'm Leganzi Kale, founder and general manager. Quabila Jones is the host of Community Conversations. Dr. Lowry Beck, he did our last segment. He's going to hang out for this segment, and he may chime in some additional thoughts on what you ladies present. I'm sure if you don't know him, he's a local pediatrician and is also one of the longtime KLEK sponsors. So, but it's not about that. It's about getting this information out into the community.
Wonderful. Thanks for having us.
All righty. So again, you all, for those of you joining back again, we're going to continue our conversation. Now we're joined by staff from St. Bernard's Healthcare, and Dr. Lori Beck is going to still hang out with us. Good morning to Vivian Taylor, Dr. Vivian Taylor, Dr. Ray Scales. We'll be going back live on air in a few moments. So just please hang tight with us. We don't want to get too deep into the conversation and leave the other people out there listening on air. So just a few moments, please.
Dr. Wade, what is your first name? I'm just seeing Dr. Wade
Okay. On
the screen.
Sorry. All right, y'all. Welcome back to Community Conversations on KLEK 102.5 FM. This is part 2, and we're going to continue our COVID conversations. We have now joining us staff from St. Bernard's Healthcare. We have Dr. Wade, and please, again, give us your first name.
Sure, it's Janelle.
Janelle, thank you. And we have Cecilia Abawaji, who's an RN and who wears many other hats at St. Bernard's. I don't have it right in front of me, I apologize. And then we still have with us Dr. Lori Beck, who is a local pediatrician. So we're gonna just dive right on into our conversation without wasting any time. So ladies, take it away. Whoever, or I'll pull names.
Well, let's start with the good doctor.
Sure. Well, like they were saying, I'm Dr. Janelle Wade, and I'm actually an ER physician. I've been working in the ER at St. Bernard's for almost 6 years. And, over the last almost year or so, been dealing with COVID on the front lines. We've been seeing a lot of patients to come in that have COVID, and it seems like the ones that are the sickest are usually the ones with either a chronic health condition or folks that are considered elderly. And so those are the ones that usually are the ones to get admitted to the hospital. And so what we're trying to do is to kind of promote the fact that St. Bernard's is offering vaccines. We have 2 vaccines that have been FDA approved, and we are offering one of the vaccines at St. Bernard's to folks 70 years and older, and we're just trying to get the word out.
Okay, well,
Now, I did have this question for you, Dr. Wade. Since you are in the emergency room and you see the front lines, could you explain, what you see? Because, you still have those people out there that don't take it seriously, don't believe it's real, or think that, well, I'm just not going to take the vaccine. I'm just going to take my chances. But could you, kind of describe some of the things that you have seen, especially among some of the sickest of patients?
Sure. So usually when a patient comes in, we see on our computer screen, that they have COVID symptoms, or they're short of breath, or they were recently diagnosed with COVID, and maybe their family physician tried to treat them as an outpatient, but maybe it's like day 6, 7, 8 of the illness, and they've come in with worsening symptoms. And usually those worsening symptoms include feeling really short of breath at rest, or short of breath just to get up and walk halfway across the room. A lot of people, they have the body aches, they have the fever and the chills, and a lot of people too, they'll have the nausea, vomiting, and even diarrhea. But the sickest patients, we consider those the sickest when they come in respiratory distress. Those are our sickest ones, where you can actually see without them talking that they're using extra muscles to breathe fast. Their oxygen level may be low, like in the 80s, and normal should be, 97, 98%, and they might be like 88%. And they could be, I've seen even young people with those types of symptoms, like they may be, 30 something or 40 something. And those are usually the patients that we're hovering around. We have to, when they arrive, hurry up and get our PPE on, run in there and make sure that we get the respiratory therapist in there, because those patients sometimes are at risk of being intubated or put on a ventilator. And so those are usually the sickest patients. And it's risky not only for the patient, but also for the staff, because when you go in to intubate someone or put someone on the ventilator, you're in close proximity to them and their respiratory droplets or secretions. And so we have to make sure that we have on a really good N95 mask, and that everyone in the room, you take care of your staff, you make sure everybody has their mask and everything on. Because when you get down in there to try to put them, to intubate and put them on the ventilator, you're actually seeing their airway, you're seeing their mouth, it's kind of a really scary situation. And when the pandemic first started, we were saying, okay, everyone who comes in, they need to be on a ventilator, because that's what we're used to seeing before the pandemic. Like anyone with that kind of respiratory status should be on a ventilator. But later on during the pandemic, we noticed that those patients tended to do better to keep them off the ventilator as long as possible. And they were able to tolerate oxygen levels in the 80s and things like that. So it was really just just an amazing effect that the virus has on people. I don't know if that was too much, but.
Well, no, that's
No.
exactly what we're looking for, because, most people don't see what you all do every single day, the rushing to attend to try to stabilize the patients, putting them on the ventilators and things like that. So if you don't physically see it, it's easy to say, oh, well, it's not real if it's not boom in your face. So thank you for your answer. Definitely appreciate it.
No problem. That's why I think it's so important to get like, as soon as that vaccine was available to the healthcare workers in December, I was the first one on the train. And of course you have, you feel hesitant about it just because you feel like, wow, this vaccine did kind of come up quick, and you feel like, oh, okay, an mRNA virus. All right. I understand from medical school what mRNA means, that it's a kind of like a message to your body to make, different proteins. And we hadn't really had a vaccine like that before. But then with my reading and my own research, you see that these are vaccines that the scientists have been working with for years. It just seems like to the public that this is kind of a new thing, but they've actually been doing these types of vaccines for years. So I was like the first one, because to me, it was more scary to, be exposed on such a frequent basis to such sick people. I was afraid of bringing COVID, because it's so contagious, home to my own family, to my husband, who actually has a chronic medical condition, and my young children. And so as soon as I knew that vaccine was available, I was like the first one in line.
Hey, my next question. Oh, did you have something, Q?
Well,
Hey,
I did.
Legacy. Oh, go
Well,
ahead.
go ahead.
Well, and I wanted to just kind of feed off of Dr. Smith Wade. Um, Outside of the ED, once we have those patients in the hospital, they have to be in isolated areas. These are people that get admitted and they're not admitted with their families. They're not allowed visitors. Most of communication is done at scheduled times by phone, or we try really hard to set up um, FaceTimes, lives with their families. So the isolation piece, if you are hospitalized and if you progressively get worse, the ICU treatment of a COVID patient is really, really serious. Many people, when they think about a ventilator, that is a tube that goes in your mouth and goes all the way down your chest into your lungs. It's like some people say it's like breathing through a straw. In order to get that tube down, we have to sedate you. Many treatments to help you breathe better, to help your lungs do what it needs to do. We may have to put you in very odd positions. We call it proning, in a prone position. So you will go onto your bed on your back, but then we will have to strap you down and we will have to flip that bed over to your face is facing the ground in some levels because that's going to help you breathe better, even
Literally
with a
flip the bed
ventilator.
over.
Literally flip our patients over so that they can have better breathing with their lungs. So it's a lot of things that go into um, these patients who have to be hospitalized. And also, before we put anybody on the vent, we try really hard to let them speak to their family members because we also know that once you get on that vent, you're not promised to come off. So it's very serious, it's very real, and we do see it, and it affects us as healthcare workers because we are there trying our best to make sure you get home to your families. And that's why masking is so important. Social distancing is so important. And getting the vaccine is so, so important. So yes, Pfizer, Moderna, whichever time it's, when it's your time and whichever one you can get first, go get it.
And that brings me to my question on the timeline. Currently, you all are doing 1B and specifically focusing on those 70 and older. Have y'all gotten any guidance on when other groups may be available? We're seeing on the news where President Biden and the Biden administration is doing all they can to get more doses out all over the country. But it's kind of like, what all have you heard? And as far as like the timetable and how it's looking going forward.
Yes, like I know we're in the phase 1B, and so we're supposed to be through the healthcare workers now into the 70 years old and up, and then I think the educators too. I think the teachers are supposed to be able to. I know St. Bernard's is offering the vaccine to the educators, higher education teachers, and things like that. I think the next step after them is supposed to be and by educators too, I mean childcare workers, first responders, and things like that. And then after that, I think we're supposed to go into the other first line folks, which are supposed to be like grocery store workers, public transit, like the postal workers and the essential community government workers. There's what I heard is that's supposed to be opening up in March, and then in April, then it'll be the younger folks, like the people 65 years and 65 years and older instead of 70 and older, and also the younger people 16 to 64 years old with like the high risk medical conditions, and so that's supposed to be in April.
Now, with
And
you
one
all
group
focus,
I like to add to that, one
go
group I
ahead.
like to add to that that's eligible now is long-term care. Long-term care residents and workers, they are eligible now. So they're in the earlier phase. So I just wanted to add them.
Okay, so with you all focusing on those 70 and up, some people in that category may not necessarily have transportation to get to St. Bernard's to get their vaccine. So are you all working with anyone? Is there anything in place to assist those who may want the vaccine but don't have the means to actually get to the facility to get it?
I'm not aware of that, I would say anyone who's over 70 plus who is eligible for any type of transportation to doctor's appointments, I would definitely reach out to those resources because they may also say, yes, we will take you to get your vaccine. I'm one, it takes a village. So I'm saying definitely reach out to your family members as well. St. Bernard's is actually providing the vaccine to everyone that is in our service area. And our service area is very large, 23 counties. So there are people from Wynne, Arkansas coming to Jonesboro to get this vaccine. So we are trying to reach a lot of people, but I would definitely say anyone who's eligible for transportation, different things like that through their insurance or Medicaid, Medicare, reach out to those resources.
And what about the nursing homes? Are they being bussed in, or are you all actually coming to the nursing home facility?
Can you hear?
Yes, we're trying to, as far as the nursing homes, I haven't heard how they're actually getting the vaccines. The last thing I heard is that I think some of the community pharmacies were going out maybe to the nursing homes. I don't know, Cecilia, if you've heard anything about that.
Gotcha. I have not heard about the long-term care facilities. I am very certain that you're right, Dr. Wade. They're probably bringing those vaccines into the facility and administering them there. Just to tell you about St. Bernard's Vaccine Clinic, we do have that open and operating. You can get an appointment if you're 70 plus by calling 351-7171. If you don't have access to the internet, or if you're just easier to use the phone, that's available. But the best way is to go online and go to stbernards.info/COVID vaccine. There is an online form that you can fill out. Our clinic is at 505 East Washington. It's at our auditorium. Once you get to the auditorium, we understand that 70 plus, you may have difficulty getting to the front door. You can always call our main line. Our shuttle will take you to the front door, bring you back to your car when you're done. So if you are not in a long-term care facility and you need to come to our vaccine clinic, very important, don't just show up to the St. Bernard's Auditorium. We need you to have an appointment. We are getting our vaccines in from the state. They are limited in number, but we're ready whenever our shipments are coming. But it's very important to go to the online system, fill out the form, or call, have an appointment, and then show up.
Okay, now looking at the current situation with the weather, have you all been in discussions about possibly going out to meet the needs of people who can't get into you?
Currently, we have only closed the vaccine clinic maybe once, maybe twice, like today, or when it's really bad, we won't have that open, but they will always notify you if you have an appointment, and they will always reschedule that appointment.
Okay.
So because of the vaccine, you have to keep it cold. You have to give it so long after drawing it up. Right now, currently, St. Bernard's Auditorium is the place to go. But those are great questions, and I think it's things that we can keep in mind as we get more vaccines and we're able to move out more. That's something we can definitely keep in mind.
We got a Facebook comment and a question. Mitchell Nail says, Mitchell here with St. Bernard's. The Jonesboro Jet Transit Service serves us, and we have a shuttle service at St. Bernard's. We don't actually have nursing homes with St. Bernard's, but our long-term care facilities with St. Bernard's were vaccinated in-house. And then Reverend Jeremy Jones has a question. Are you able to give clarity to the current vaccine? Some medical staff have stated that the vaccine is for the strand that was discovered in 2019, but there have been one or two other strands discovered. How does the current vaccine protect us against those strands?
That is a great question. I don't actually have the numbers, but I do know for a fact that the vaccine does provide some protection against the new strands. I don't think it's, as good of protection as it was to original strand. But it's kind of like, if you think about the flu shot, I want to say the last year they tested, it was only like 39, 40 something percent effective against the last flu strain. But that was still better than nothing. And so the fact that the Pfizer and Moderna are 95 and 94% effective is super high, like, you know, almost perfect. And so I would think that, you know, getting the vaccine is still a good idea, not only for protection from the original strain, but also from the new strains. Just because in these new strains, there's still components of the virus that the vaccine will protect you from. So I definitely recommend. I wouldn't say, okay, there's new strains, so I'm not going to go get the vaccine because I don't think it'll be protective. I would not do that. It still has a lot of protection from these new strains. And so we definitely recommend it. And I kind of wanted to speak on my experience getting the vaccine, just for folks that are kind of wondering like what it's like compared to the flu shot. Yes, you have a sore arm. It only lasts maybe a day or two. The first vaccine, I really didn't have hardly any symptoms. Felt maybe a little run down like you would with any vaccine. Now that second dose, and I had the Pfizer vaccine. I did get that shot, sore arm again. And later that night, I did have a slight fever, maybe 101. And I felt, you know, kind of the body aches, and I had a headache. Then the next morning, everything was gone. And so it was kind of a thing where, yes, you feel bad, but you also feel like, okay, the vaccine is doing its job. Okay, now I'm protected. You know, they say it usually takes a couple of weeks before the actual protection kind of kicks in all the way. But one thing we do recommend is that even though you do get vaccinated, that doesn't mean that you can't still get the virus. You just don't get as sick from it. You won't, very, you know, less likely to be hospitalized and to die from it. And so it's real important to realize that you still have to put on a mask. You still have to socially distance, just because you can still, we think, maybe transmit the virus. And so this vaccine, the point of it is to keep folks from dying from it.
Okay, we're gonna have to put a pause right there because we're gonna take a quick break. For those of you listening on air, we're gonna continue on Facebook, so you can join us over there. We will continue on, but we will be back after these announcements. Okay, sorry. And so I wanted to actually go back and ask a question. I know we kind of moved past it, but just to, and I understand without looking at individual data, cases and their health, pre-existing health conditions, you mentioned about how some people fare better by not getting immediately intubated. Do you feel that some people may have had better chances of survival if they weren't intubated as quickly? And again, I know you can't say without looking at individual cases, but do you think that some medical professionals have been rushed to ventilate and then versus kind of?
In my opinion, my humble opinion, I'm by no means any expert, and just being an ER doctor, I'm not like the ICU critical care doctor, and they probably see more of what happens down the line. But in my opinion, at the beginning of the pandemic, I think we were probably intubating too early. But at that time, no one knew. Like, this was all kind of a new, even though we know about the coronavirus, we learned about it in medical school. The way we learned it is the coronavirus causes the common cold. And so it's crazy that now it's become so virulent and so, you know, deadly. But yeah, I think at the beginning, we didn't realize that, you know, if you intubate early, it's hard kind of to get them off the ventilator. And I think that's what they were seeing. And then once everyone around the country started realizing that, then we went back to okay, let's try to give him the high flow oxygen, which is like a cannula that you put on your nose and it kind of blows air in, and that kind of keeps folks from needing to be ventilated. Let's put them prone, you know, things like that, to try to avoid it.
Okay.
And I'm not a physician, I'm a nurse, but I did want to just add, I feel like ventilation is something how do I want to say it? When someone comes in with COVID, yes, it's COVID, but we're looking at what's your oxygen stats, what's going on
Okay.
with you. And at that point, we're treating what's happening with the patient. So
Okay.
we don't like to say COVID, ventilator, prone position, but it's like, do they need this now? Not yet. Okay, now? Not yet. We really
Okay.
go off of what the patient is presenting with. It's more of symptom management to get to the optimal or the best possible outcome, more so than a recipe.
Okay. I do want to say thank you to everyone, you all, for being there on the front lines, for helping patients. I am by no means a medical professional, so I have no clue, but I just want to thank all of you and Dr. Beck, for all that you all do to try to keep patients healthy and safe and provide the best care, based on the facts that you have right in front of you. Again, as you get into it, more, shoot, um, sorry, more symptoms will present themselves. And so you adjust accordingly. We're going to get ready to go back on air in about 10 seconds. So we will let you all wrap up. And Dr. Beck, if you have any final words in this last segment.
Okay. You
Right,
saw me.
here we go. Welcome back to Community Conversations on KLEK 102.5 FM. We're joined by Dr. Lori Beck and some medical professional, a nurse, and let me start over. We're joined by Dr. Wade and Vasily Abawaji from St. Bernard's Healthcare, Dr. Lori Beck, local pediatrician. This last segment is fairly short, so I'm going to let them have the floor and answer any final questions, facts, myths, dispel any of those, whatever other information you have for us. Go ahead, Dr. Wade.
Okay. I guess what I would like to say is just kind of encourage, like I've done with my family and my close friends, to go out there and get the vaccine. And St. Bernard's is offering it to folks 70 years and up. And Vasily on the last segment talked about how to get in contact and sign up via the website and the phone number. I just wanted to kind of put out there, I know there's a lot of hesitancy in the African American community. And I think a lot of it's based on, historical, like we're not, America doesn't have the best track record as far as ethics and as far as the government and as far as experimenting on Black folks. And it's kind of a thing where a lot of people, especially the ones that are more elderly, remember that stuff. And so that's kind of what has held up some of my own family members. So you just have to make sure that you realize that this is kind of a worldwide effort. We're trying to help everyone. We're not targeting anyone. We just need to get the vaccine out there, not only to protect the different ethnic communities, but also, the world as a whole. So please go out and get vaccinated. All the healthcare workers, most of them have gotten vaccinated. We're doing fine. I think it's helping us from getting sick because we're getting exposed to COVID people every day. And we're doing good. So that's what I wanted to say.
That was one thing. I'm sorry, real quick. Some people when we're talking about mask wearing, there are people who are against it and saying, well, the medical professionals are getting sick and they're wearing masks about, all of those statements. I'm like, but it's kind of a different situation. So yeah, still wear your mask, people. Please, please, please wear your mask. Vasilia.
Right. Yes. Just echoing everything that Dr. Wade has said. Please go get your vaccinations. I'm fully COVID-19 vaccinated. I was vaccinated at St. Bernard's. I want to add that this vaccine at St. Bernard's is completely free. All right. The government is paying for the actual vaccine, and there's no administration fee at St. Bernard's. So it's completely free. And I want to echo people in my community, people who look like me, have a lot of hesitancy, but we do have African Americans who are dying of COVID. So I want to share just a few numbers. I'm talking about the state of Arkansas. We've had 314,000 COVID cases. We've had 5,300 COVID deaths. And when you talk about ethnicity, Race, 16% of those state numbers of those who have gotten COVID were Black people. That's 50,000 African Americans. If you want to talk about deaths in the state, 14% of that number, 14% have been Black people, which is greater than 740 have died of COVID-19. So I understand the doubt. I understand the questions. I understand that there's still a lot of questions that don't have answers, but those stats are real numbers. Those are real outcomes. And I don't want that. I don't want this to be another history lesson into what happened to the African-American race during the COVID era. I don't want my grandchildren learning about that. So please go get vaccinated. I too have been vaccinated and I had very minimal effects. I like to call it an immune response. I knew my body was working and it made me really, really happy. Okay. So please, please, please go get your COVID-19 vaccine. stbernards.info/COVID-19 vaccine, and also 351-7171 to set you up an appointment.
Okay. We have a question real quick in our comment section. This comes from Jeremy Jones. Do you believe enough testing was conducted before vaccine going on the market, as well as there are successful cases of the vaccine? There are cases that individuals have developed other health issues that started after taking the vaccine. For example, a friend of a friend has been shaking since taking the vaccine. How do we put our community at ease and encourage them to get the vaccine? No, that's a lot.
That's a great question. You hear stories about things, and it's a hard question to answer because it's hard to say whether they were going to develop that condition anyway, or if the vaccine triggered anything. But as far as studies go, there haven't been any major conditions caused by the vaccine. Now I've heard and I've seen, I can just tell you what I've seen. A few like little minor allergic reactions. Like I had one patient come down after she had her vaccine the previous day, and she had like kind of a red spot around where the vaccine was. And she had kind of a rash that was a little itchy and was easily treated with Benadryl. And we gave her Benadryl and had her sit for about, an hour or so, and she got better. And so, yes, there are minor, conditions that have come up from this, but I personally haven't seen anything. But I'm just in the ER, so I don't know what anyone else has seen.
Okay. In our last
and one thing I'd like to add to that, if they truly are having those symptoms, they need to report them, because we have had very low numbers of severe side effects to this vaccine. So if you are having this shaking, be sure you go to the website, Vaccine Adverse Event Reporting System, VAERS, and report those, because we do need to study it and we do need to know and try to decipher what happened. So please report any symptoms via that website.
And can you put that information in our feed so that people can go back and look at that?
I sure will.
All right, Dr. Beck, we have about a minute and a half. Do you have any final words you would like to chime in?
Just one, kind of piggybacking on what Dr. Wade said about the question on the variants. So far, there's been three main variants, three main strains that have come up. One of them, the United Kingdom UK strain, the two vaccines we have already seem to work just fine against it. So it's so far so good with it. The other two strains, one is a South African and one is a Brazil strain. There is some concern. There will be some efficacy, but it may not be that 94 to 95% efficacy we have right now. But the good news is researchers are trying to stay ahead of these variants, and they're already working on modifying the second dose of the vaccine to cover those. And for those like myself, and probably Dr. Wade, that I've had 2 doses already, they're working on maybe a third dose in the future that will take care of these two strains that are our concern. So don't panic. I know a lot of people are having a panic attack over these strains and thinking it's going to kill all of us. If you panic around your kids, they're going to panic. So don't panic. Work is being done, and people are staying on top of it.
All right. Well, we want to thank you all so very much, and thank everyone on our Facebook Live feed and listening on air. So if you all could please go back to our Facebook Live feed and look at some of the questions and comments. We want to say thank you to Mitchell Nail for jumping in and answering a few questions for us. Ms. Janice had a question about her husband who works at a food agriculture facility and asking about when vaccine may be available. So thank you, everyone. This is a community affair. We all need to step in and help each other, educate each other. Well, get the education from the professionals and pass it on to those that you know. So thank you all for joining us. Thank you for tuning in Community Conversations. Everyone have a great and blessed day. Ooh, okay, we're still live on Facebook. So
We can go a
again,
couple minutes longer on Facebook if you all, got the time. All right,
so
everybody good?
I want to
We
ask you a
did.
question. Oh,
Well, obviously we have a question on the live feed.
go ahead.
Clarissa Nicholson says, is there any new research on how long the vaccine will be effective? Will we need another round in 1 year like the flu shot? So anybody that wants to answer that can answer it.
Well, I'm not for sure certain, but I want to say the number I heard was, every 1 to 2 years that it'll be similar to the flu shot. I don't know if Dr.
I
Beck.
agree with that. Yeah, that seems to be what we know so far. Best guess, 1 to 2 years.
And I will add, and the physicians can correct me if I'm wrong. I know a lot of studies are still being done on the variants. And if they do deem it necessary for us to have our booster because of the variants, that may be something that has to take place, but still studies are still out there and they're learning and gaining that knowledge now.
One question I want to ask, you all talked about, based on the question that was asked about someone developing health-related conditions after getting the vaccine. Should someone get a full workup before getting the vaccine just to know what is possibly there, so that the doctors can have something to work on if other symptoms show up after the fact? Dr. Beck or Wade?
Well, it's not a bad idea. I mean, people need to keep their scheduled checkups anyway. But yeah, if there's any question, or if it's been more than a year since they've had a complete physical, or if they're having any issues that have come up during that year, I would agree with that, to go get a checkup, get a physical first, make sure everything's good. Discuss any concerns or problems you're having with your local provider.
Okay. What about medication interactions? Has that come up? Are there any details on the CDC's website about medication interacting with the vaccine?
I haven't heard of any. I don't know if either one of you have.
No, none whatsoever.
I have not.
And
Okay.
it's unusual for a vaccine to interact with medicine anyway. So it's
Okay.
I don't think that's even a relevant idea.
Okay.
Nothing.
Alrighty. Dr. Legans, did you have anything else?
No, that's it. I think that pretty much took care of the questions. I'm in the live feed. Of course, as Kubila said, maybe later on today, if you all could just maybe kind of check back in case some questions are posted after the live video ends. And just thank each and every one of you for agreeing to come on. Definitely want to bring all of you back again to continue getting the word out. And thank you all for all that you do.
Appreciate you guys.
Thank
Thank
you.
you
Thank
all.
you. Y'all have a great day.
You too. Bye-bye.
Well, too. Awesome job, ladies.
All right.